Now, the most important point which you have to remember for the Gaucher's disease is which population is most commonly affected in the Gaucher disease. So, this is the Ashkenazi population that is most commonly affected. So, how will you remember that the Ashkenazi population is most commonly affected? This is very simple. Just write Gaucher here. So, in the Gaucher, just take A, C, and E. So, this A, C, E will tell you that its pronunciation is S. So, S means Ashkenazi population. So, S in the Gaucher itself, it is telling that Ashkenazi, just derive Ashkenazi population from the ACE. So Ashkenazi population is most commonly affected. Now, how will you prevent the Gaucher disease? So we can prevent this Gaucher disease by screening the Ashkenazi population. Among the Ashkenazi population, as these population are most commonly affected, so screening among all these population can reduce the chances of Gaucher disease. So only this much you have to remember for the Gaucher disease. First very important point is the which population is affected. This is very important MCQ. Second, the treatment. How will you treat this patient? So treatment is first by the enzyme replacement therapy and second by the substrate reduction. In the enzyme replacement therapy we use velaglucerase, and in the substrate reduction therapy we use miglustate. Okay, then after treatment, the diagnosis part is also very easy and very simple. Just by the enzyme assay, by the bone marrow picture. In the bone marrow picture we will get the Gaucher cell, and in the Gaucher disease the level of alkaline phosphatase, angiotensin converting enzyme, and immunoglobulins are increased. Then the important point about the Gaucher disease is the neurological symptoms. About the neurological symptoms, there are two types. There are three types of the Gaucher disease: type 1, type 2, and type 3. Type 1 is most common among type 1, 2, and 3, and this is non-neuropathic and this is very less severe. Type 2 is type 2 Gaucher disease is very severe, most severe, and this is life threatening. This may cause death of the individual, as because in this there are a very severe CNS symptoms like dyspnea, dysphagia, blindness, and many more CNS symptoms. And this appears early in the life, that is why it is called as the infantile, and it appears very for a very less time, and it causes very high level of injury, very high level. Even it may cause death of the individual. That is why it is acute infantile Gaucher disease. So there are three types: type 1, 2, and 3. Now, after neurological symptoms, these other symptoms like bone marrow insufficiency, anemia, bruise, bleeding tendency increases, infection chances increases because of the decrease in WBC count, bleeding chances of bruise easily because of decrease in platelet count. So coagulation or blood clots will not formed in the body, so the person will bruise very easily. The RBC count decreases because of this, anemia develops, and the patient gets fatigue very easily. And these are the large sphingolipids, and this accumulated in the liver and spleen, it causes hepatosplenomegaly, and in the brain it accumulates and it causes various neurological symptoms. Now after the symptoms, the how the disease progresses in the pathogenesis, we discussed how the crumpled cell or Gaucher cells are formed. These are formed because of the deficiency of beta glucosidase or glucocerebrosidase or glucosyl ceramidase, and because of this the GM3 get accumulated in the macrophages, and These accumulated in the macrophages as a fibrils, and because of this the cell looks like, the macrophages looks like crumpled or wrinkled tissue paper like appearance, and these are called Gaucher Gaucher cell. And how we derive the enzyme or the accumulating agent accumulating agent by the Gaucher name itself, by the Gaucher name itself. So it is a, from the Gaucher we have derived the glucocerebroside. So glucocerebroside increases, and glucocerebrosidase enzyme is deficient in the Gaucher disease. Its other name is beta glucosidase, other name is glucosylceramidase. And in this disease, and in this when in this disease the glucocerebroside or GM3 is very high, gets accumulated. This level, this sphingolipid get accumulated in the body. So ceramide is formed after the degradation of the glucocerebroside. So, and from this CU we remember that this is a most common sphingolipidosis. So my dear friends, this is all for the Gaucher disease. I hope this video will be very helpful for you, my dear friends. And if you really gained something from this video, a very little, if you have gained something from this video, then please share this video as much as possible to your needy friends. And in the last, thanks for watching this video, and I wish you all the best for your bright future.